go over some common misconceptions in society today about bioidentical hormone replacement. So one of the common misconceptions that we get here with current patients is if testosterone is so common being low in men, why don't more doctors treat this as a usual primary care physician?
Well, I mean, that's a really, really good question. You know, as we age, certain things happen. We get arteriosclerosis, hardening of the arteries, we get arthritis, our cholesterol gets worse, our blood sugars go up, yet we treat all these things. As we age, our testosterone level drops. And we don't treat this as much. And there are some unfounded fears regarding testosterone, which are really not accurate among patients and among physicians. And also, when treated properly, those things I mentioned, arteriosclerosis, diabetes, increased blood sugars, high cholesterol, testosterone can have an amazing effect on all of those as far as decreasing and even reversing them.
Ah, okay. So you mentioned prostate cancer. So when I come in and I get bioidentical hormone replacement and I get testosterone, is that going to increase my risk in prostate cancer?
Okay, that's a really great question, and it's one of the most common misconceptions about testosterone replacement. So, number one, men who get, let's think about it common sense-wise first. When you're young, when you're 26 years old, 25, your testosterone levels are very high. You do not have prostate cancer. When you're old, in your 70s, your 80s, 60s, 70s, 80s, now you're developing prostate cancer, and it's getting worse when you have little to no testosterone. So the whole idea, common sense-wise, that testosterone increases risk for prostate cancer is completely untrue. Number two, it's been proven. Testosterone supplementation will not increase a man's risk of getting testosterone. We know that for a fact. Now, there was a study back in, I think, the 1940s, 1941, on 2 patients, actually it was a total of 3, but 2 patients who were on testosterone that already had prostate cancer. It caused it to grow faster. So since that time, based on 2 patients, we've been treating metastatic prostate cancer by decreasing men's testosterone levels. That's treatment of active prostate cancer. However, studies have proven that it will not increase your risk of getting prostate cancer. And another important thing is studies are also showing that men who get prostate cancer typically have low levels of testosterone. So higher levels of testosterone, hence, would be protective or theoretically protective against prostate cancer.
So theoretically, if I have low testosterone and I do not have prostate cancer yet, and I'm getting bioidentical hormone replacement with testosterone, there's little to no risk.
Yeah, exactly. I mean, unfortunately, as men, we're all at very high risk of getting prostate cancer. There have been studies showing that men who died in their 20s from whatever reason, they found, prostate cancers in them. So prostate cancer is really not well understood, but we do know that in some men it's very benign, and in some men it can be very aggressive. But we know for a fact that, number one, testosterone won't increase your risk of getting it, and number two, men who typically get it, chances are, have lower levels of testosterone. So you can feel very safe that as long as you don't have prostate cancer or you have a normal, what we call PSA, you can be on testosterone therapy. Now, if someone has a very high PSA or risks for prostate cancer, something that may indicate a malignancy, we don't start them on treatment. We want them to get worked up first. Okay. And we can actually treat patients that have had prostate cancer as long as they've been treated definitively with either surgery or radiotherapy, and their PSA is 0, they can be treated, and they do quite well.
Great.
There's actually been about 19 studies to prove that there's no link.
Wow.
Yeah.
So bioidentical hormone replacement, testosterone for men, it obviously will increase my health, and it'll make me feel better.
Yeah.
But does it actually make me healthier as a person?
Yes. Okay. And again, let's think common sense-wise. You're a young man, you're under 30, right? So he looks good.
I wish.
Oh, I thought you were. He looks good, he's healthy. His arteries, if you could see them, they'd be clear and clean. His joints are without arthritis. So what's going on? His hormones are at a high level. But as you're getting older, these are dropping. And as that process happens, disease process sets in, whether it's arteriosclerosis, hardening of the arteries, plaque, arthritis of the joints. So there is a protective effect of hormones, of these hormones. They protect your body, they protect your joints, they protect your heart. Testosterone is a really potent anti-inflammatory. And the new way of thinking with heart disease is that it's an inflammatory process. So, you know, in European models, you could have high cholesterol, but they may not get heart disease because they have lower inflammation than we do. We look at many things. Testosterone is an anti-inflammatory. Diet, antioxidants, you know, certain foods that are rich in antioxidants like blueberries, dark chocolate, flavonoids, things like that. So our program really revolves, obviously not just around the hormones, although we do like that, but when we can incorporate all that, we can reduce your risk for heart disease. There are numerous studies to prove it and confirm that. And also, the other misconception is that there's an increased risk for blood clots. And there was a study in 2015 at the VA that showed a slightly increased risk for blood clots in the first 6 months of treatment with testosterone. But there have been numerous studies to completely disprove that, and there were many problems with that studies that when those numbers were actually looked at accurately, there was not a significant increase at all. And you can feel very safe that testosterone will not increase a person's risk for heart disease. It should decrease it.
Okay, so all in all, overall, testosterone bioidentical hormone replacement is
very healthy.
Very healthy and low risk?
Yes, and also I forgot to mention its effect on our blood sugars, on our insulin resistance. Testosterone decreases insulin resistance. So as you get older, as you get above 40, we get a little bit more abdominal fat, we get insulin resistance, our insulin levels go up. That accelerates arteriosclerosis. Some will develop diabetes. Some will have prediabetes, what we call metabolic syndrome. Well, the testosterone increases your sensitivity to insulin. So you're going to have lower levels of insulin, you're going to have lower blood sugars, and we know for a fact that lower blood sugars develop less complications, less heart disease. It's all about reducing risk for heart disease and also getting a patient feeling the best that they can feel.
Great.
Yeah.
Great. Thank you, Dr. Radbill.
All right. Thank you.
So if you guys would like to continue to follow us on Facebook and Instagram at Renew Us or Relieve Us, we will be doing these videos as much as we can. If there's any misconceptions that you guys have or questions that you guys have, please comment on this video and we will make another video to answer those questions. If you guys need to contact us for any reason, our number here is 888-985-2727. Also, renewusorrelieveus.com. Thank you very much.
Thank you.